All right, folks, so this is a brief lower extremity kinematic review. As we discussed in lecture, I'm providing this review to begin to link some concepts from the hip to the knee to the foot and ankle. If you want more information, I would encourage you to look at your OATIS text from both GATE as well as Biomechanics, the third edition, chapters 47 and 48, beginning at page 929. But before we actually dive into kind of the particulars here, a quick word from our sponsors.
Hi, my name's John Fox. I'm just a biomechanist, and I approve this message.
All right, so as we get started here, one of the images that we discussed was this one, right? Now, before we get into the weeds too far, the first thing we need to remember is completely disregard the information on the VMO, the vastus lateralis, so on and so forth, right? The reason this image was in our notes was to take advantage of some of the positional variation, right? Namely, the femoral anteversion and lateral tibial torsion, as well as the genu valgum or genu varum. As we've talked about from the beginning of the semester, the quadriceps has one innervation, the femoral nerve. If the femoral nerve generates an action potential, the quad's going to fire. You can't preferentially fire the VMO versus the vastus lateralis. It's an all or none response. So disregard all the rest of this, okay? What I want you to focus in on is some of the morphology changes. So for example, femoral anteversion. Remember, femoral anteversion is a morphology change at the femoral head and neck. And typically what we see with that is an increase in genu valgum at the knee, right? This would also increase the Q angle. So we see an excessive Q angle here in image C, right? If that is occurring, likely we will see excessive foot pronation at the foot and ankle, okay? Now, all of this is regarded as skeletal morphology, meaning it is the shape and the orientation of the bones. We're not talking about rotations, which would be osteokinematics or anything at this point. We'll get into that shortly. So to illustrate this further, OATIS gives a nice application of this in figure 38.22. And she notes that to compensate for excessive femoral anteversion, locating the femoral head appropriately within the acetabular. Remember, we talked about lining up the center of the acetabular with the center of the femoral head. And that's where we see the compensatory either positioning of the foot with more toeing out or more toeing in to better align in either a retroverted or an anteverted hip position, right? So in this case, someone who has anteversion is going to rotate the hip medially so that in standing, the knees actually face medially. And that's what is illustrated here with the red arrows and kind of the red curves, is now the patellas are squinting in. Even though there is not an excessive degree of genu valgum in this image, you can see that the patellas are turned inward, right? However, there's also a secondary compensation, and that occurs at the tibia. So the tibia also undergoes adaptation by then developing the lateral torsion. And the reason why this occurs is so that the feet are directed straight ahead so that there's no longer an exhibiting of a pigeon-toed or toeing in posture. So we have things that are going on at the hip, anteversion. We have things that are going on at the knee, more of this medial positioning of the patella. We have a lateral tibial torsion that's occurring, and that's occurring to better position the foot and ankle in the sagittal plane. Now, this is also what we've talked about, which is just an illustration of what we've already seen, right? If that femoral neck is in an anteverted position, we're going to see external tibial torsion, which leads to a little bit more of a pronated foot posture. If we see femoral neck retroversion, we're going to see a decrease in the Q angle. We may even see some genu varum, and there's going to be internal tibial torsion. Now, where the confusion often lies is when we're talking about torsion, we're talking about morphology. If I take something like this is a cloth mask, right? and I wrap it up and I start wringing it out as if it were wet, right? I am creating torsion, but there's no rotation that occurs until I start to actually move the bone, right? This is a mechanical property idea. Our internal and external rotation is a movement, is an osteokinematic. It's a movement of the bone. That's what you see on the right-hand side of your screen. When we start linking this to the foot and ankle, we start to see that supination and pronation are tied to osteokinematics of the tibia. So while external and internal tibial torsion are mechanical properties, lateral rotation or medial rotation, otherwise known as external rotation or internal rotation, are components of the tibia actually turning around the axial axis of rotation. So when an individual begins in our top image here to supinate, specifically through the hind foot, the tibia is going to laterally rotate. And what ends up happening with this is the plantar fascia becomes tighter and the ligaments provide a stable foot for push-off. Conversely, when there is medial rotation of the tibia and the hind foot is inwardly rotating or pronating, that medial longitudinal arch is going to begin to kind of splay out. And it's at this point that the plantar fascia and plantar ligaments become more taut, but here it's to absorb the ground reaction force as they make broad contact with the ground. And so we have a lot of surface area for contact. To illustrate this further, we can actually look from the vantage point of the hind foot during pronation and supination. So during pronation, our calcaneus is going to evert or go into a more calcaneal valgus, hind foot valgus position, which leads to more of a pronation moment on the medial side. This is accompanied by leg or specifically tibial internal rotation. During supination, we see the calcaneal inverts, or we have hind foot varus, and specifically this leads to external rotation of the tibia. Again, we're talking about rotation, not a morphology change like torsion. So if we link all of this together now, we can begin seeing how the entire kinematic chain functions, specifically in the transverse rotation idea. So at initial contact of stance, we land in a supinated position with our pelvis, femur, and tibia all internally rotating. Then as we begin to move into pronation, right, we see that internal rotation continue. And then as we start to move out of pronation and into supination, we begin to see an external rotation, which again matches with what we've talked about thus far. Again, supination and pronation are occurring at the subtalar joint, whereas the talocrural joint is primarily where we see dorsiflexion and plantar flexion. I hope this overview has helped in terms of linking the pelvis to the femur, to the tibia, and now to the foot and ankle. If there are additional questions, please reach out.